For combination cases that you've done, some complex cases that you've done, the thought of the order that you would you do the ZEPTO first, carry on with a secondary procedure, then go back to finish off the cataract with phaco?
Yeah, I mean, actually, a number of our cases we've done have been combined cases. Whether, for example, they're combined with glaucoma procedure. We've done them with MIGS. We were in the OR the other day. We did a number of MIGS procedures as well. I think that it really again depends on preference. I mean, I like to do, for example, all of my MIGS procedures before doing the phaco. Mm-hmm. And so we basically, in a couple of cases we did the MIGS procedure first, and then we did the ZEPTO. Other cases we did the ZEPTO first, then did the MIGS, and then did the cataract extraction. So I think that to me is probably the best way to do this. I think is really to kind of start with the capsulotomy, get the capsulotomy done, mm-hmm. and then proceed with doing either the cataract, then the glaucoma procedure, or doing the MIGS, for example, first, and then doing the cataract second. Mm-hmm. That's the way we've done it. Of course, if I'm doing any iris repairs, I do them after the cataract's been removed. In that case. But I think that. For me, what makes most logical sense is to get the capsulotomy done, get it out of the way, best visibility, mm-hmm. and then you can use whatever viscoelastic you want after. Yeah. You can, move around the pupil if you have to afterwards, if you need to. So that's basically what I would say in the combination case.